concerns that have been raised in the letter. I'm just not clear. You said, I think a communication received on the 29th January about closing of wholesale. I don't think I'm copied, so I don't know the content of the letter, and really I cannot give clarification on them, unfortunately. That's the first issue I'd like to say. I mean, just looking at the agenda item, it's talking about mandatory testing of drugs into the country and listing of drugs. I mean, I only know about the communication that we wrote, I think that you are making reference to. So unless I have more insights, I may not be able to give appropriate response with regard to that.
Yeah, thank you. Okay, thank you very much. I think then we'll have to take time so that I can go through the letters. Yes, in the meantime, you can body two. I am. Yes, you are right. I'm just being informed by the vice. If you look at the letters we received, the addresses, it is definitely addressed to the National Assembly Select Committee, but the office of the President is copied. Medicine Control Agency is also copied.
You also mentioned something of the 29th January, right?
Yes, they all, and then that one to the office of the President was copied, likewise Medicine Control Agency. Both the two letters.
I don't know. I may have seen this one of 7th January, but nothing on the 29th of January. That much I can be sure of. Huh?
What's the 10th of January?
Yeah, I'm just saying, maybe 10th January is possible, but the 29th of January, I'm not seeing any communication to that effect, but let me read it.
So, okay. Yes, Honorable.
Even though we are copied, but did they send the letter to them?
Well,
I think that's something which you need to verify. That's why these people should be here today. They should be here today. At least, so they're here. What? They family association. But at least that's the direction. So should be here.
No, just go ahead.
So that's my thinking. I don't know. Well, you assume that the letter is sent to them, so
This one.
they are copied.
Yes. You see this one, the 10th, this one.
They are copied.
very yet.
Are you sure?
And they are part of the show, so I don't know.
Huh?
Anyway, I think we are all speaking the same language. We are all speaking the same language. It's probably maybe a breakdown of communication, but that is not for us, it's for them. For us, we are acting on information that is sent to us, and then that we officially receive. And in the information, it is indicated that the MCA was copied.
Yeah.
Whether they receive it or not, that is for.
So this one now, looking at this, I've seen this.
Okay.
I've seen this one.
That is it, letter the first one.
The first one, the 17th.
okay.
But the 29th, I certainly have not seen it.
Yes, dear.
Yes?
Yes. For us that we receive the communication, we could pick up certain agendas that we want to discuss with them. Let us put us straight to them. Because I think if we look at the letter very well, it's either accepting what the president proposed to them. We were informed that after 3 days when we went our tour, and we find out that congestion of whatsoever, we thought and we gave the ministry and MCA to come to a decision in trying to understand that testing some of those products at that particular time is not feasible. And MCA have told us. And within a short given time, we received a letter. I think it was copied, a letter from MCA to these people. And constantly this forward and coming is coming. And then for me particular, if the board is here, we want to know who is directing MCA. Because MCA is under a board, as we understand, and we expect that that board is in control and is giving directive. If there is anybody outside the board that have those powers directing, because one, and I so said that we need to write and commit the assembly itself on their doing. Because the last time we did not commit both the minister and the MCA. And then we need to have a stand that everybody knows that this is the stand of the assembly on this subject matter. And then some of the issue is the registration of product, the quarantine of those products, and the way and the manner that MCA is dealing with these people, because we are facing challenges. We represent people. There comes a time that we understand that there are people that want to boycott and go a sit-down strike. And we don't want us to reach to that sit-down strike. We want to amicably look at issues.
Thank you very much. Thank you very much. I think we're just trying to be on the same page with them. We put it to them that we receive this communication. So they are trying to verify, and because as indicated, it was copied to them. They're trying to verify whether they have seen the communication or not before we go into the discussion properly. There are many issues highlighted there, but as we communicated, it's the issue of registration, testing, and listing and so on.
Okay, let me, I think I have a rough idea of the issues, and I will try to address them. I think the first issue of mandatory testing. Let me start with the issue of mandatory testing of the drugs imported into the country. This issue, to me, is a foregone issue, which we had addressed, and I think the latest communication we had to the importers was that we are going to not implement mandatory testing for everybody, for every product, but for high-risk products, especially syrups that have the potential to be contaminated with, DEG and EG. And I think that was communicated to all of them.
Okay.
So with regards to the mandatory testing, that is what I recall is actually what is on the table.
Okay.
With regards to we're doing this risk-based survey where we have collected syrups and, from all the different importers. Not that we were able to test all, but at least almost half of them were tested. And we're receiving results, and the way we're receiving results, that's the way we're actually taking actions. The other issue, I think, is the issue of registration. I recall seeing that letter of the, is it 10th of January, where they're making claims that MCA said they were going to waive registration requirements. And that is clearly not true. MCA has never said they will waive registration of products, no matter where it's coming from. I think what we said was we were going to try and see how best to implement it. I recall the meeting even in the meeting with the president. One of the stakeholders did mention the challenges that they do face when it comes to registration, submission of registration requirements of products that are coming from, I'll call them the stringent regulatory authorities. It is a WHO term that they use for highly regulated countries like the US, the UK, Europe, etc. I've never said we will waive registration for any product in this country, because I said registration is a key and mandatory requirement in the Act, and no country waives registration because of the country of origin. But what we could try and do is actually to probably reduce the documentation requirements so that they be able to comply. And I remember it was, as I said, was mentioned in the presence of the president, and I clearly said in the front of the president that we are ready as a regulatory agency to negotiate some other issues, but not the issue of registration. Having said that, the other issue I think that was, a problem was the issue of providing the certificate of analysis for products that are coming from these SRAs, Europe, UK, etc. And we had discussed and agreed that we will, as an agency, even though this is what the Act says, in the interest of public health, in the interest of having access and availability of medicines, we would, in the meantime, accept some other documentation like the MHRA when it comes to UK, some certificates of conformity, certificate of origin, and other documentation that may support, the origin of the product to see its authenticity. But even that, as I said, if we're going by the Act, that's not what it requires. But because of, as I said, all these engagements, we have been accepting those and releasing products based on that. The issue of, I know we are also written to say that all products must be registered as a directive by the 31st of December, where we know that sometimes the feasibility, even the capacity to handle that may be a problem. They also, as importers, the stakeholders may have a problem because they cannot maybe register everything at once. But what we're trying to clearly communicate is that the registration, requirements for registration is still in force. We are not going to negotiate that. But it is just a means of trying to encourage them to be increasing, and identifying the products that they want to be registering. Listing is something that I think I've explained here before as an alternative to give them time, to sort themselves out, to also for NCA to know, because of the challenges with capacity, to know what is in country. This listing, as I said, is also in force. We initially said products that are listed, products should have been listed annually, and then initially they wrote to say that it's becoming a challenge because of financing, and so we said, okay, as of 2019, I think, or 2020, if you've listed it before, we would waive the requirements. But even now, we have to bring that in now, and there is a communication that's in the pipeline that will go out to all importers to show them that all products that have been listed before, with effect from earlier, would be deemed as expired, and they have to list these products that tentatively are a problem in terms of getting registration documentation. They will have to submit it. The listing fee also has been updated to $50. So they list products that have been listed before as just for this year. But any new product, we will not accept any new product for listing. If you want to bring a new product into this country, it has to be registered. As I said, this communication is in the pipeline, it hasn't gone out. Because all these days, we have been equally concerned about the way forward and how are we going to implement the regulatory requirements. In the meantime, in consideration of the importers, to make sure also that we do not stifle the supply chain. So these are the things that we have have discussed and have been implementing. And to be honest, I'm not quite sure whether there's anything else here. I think the only issue I see here with all this text is about the issue of being able to produce the relevant documentation, and that registration should be waived for products coming from other countries. And that is something that no country, I mean MCA, with the support of the board, the ministry will not condone that. We'll see how best to give them time to be getting products that they can register, but that we're getting it from Europe, so we will not register it is not something that is a reasonable request, and it cannot be entertained.
Any other? Or
Yes, we have it. I think with regards to mandatory testing, registration, and listing, this is what I have. We have maybe other issues of things we try to wanting to put in place with the support of the board. What we want to put in place to address this issue of testing, but that is not actually what is in this letter. Have you read it?
Yes.
Yeah. Can you want to say something, Baba? Oh,
yes, honorable members.
Yes, I just want to, as I said,
No. What you want? You have a question, or you have a comment, or you want? You are talking of procedure.
I just want to clarify something.
You have to clarify something.
Yes.
Okay, then you can go ahead.
Yes.
But not necessarily a question.
No. It's a clarification. So mean that there is no product that is under mandatory quarantine.
at the moment, unless it is a product, as I said, if it's a high-risk product, high-risk syrup, actually, to be specific, high-risk syrup. And honestly, coming from the office, no, I'm not aware of any such product that we have put now for mandatory testing at the moment. Are you aware?
Yeah.
Do you have to tell me or you don't have to?
But as I
That's the clarification you wanted.
Yeah.
If you have questions,
I have a question.
substantial ones,
Yes.
please note it down.
Yes, I will.
We hear from Mr. Savali. We'll have the opportunity to also with that, inshallah. Yes, Mr. Savali. Earlier, you have enough breakfast.
No, we take photo, and there's no photo here today. Good morning, Mr. Kia, members of the National Assembly, Chairman of the MCA and the Executive Director, my colleagues. Just to emphasize what the Executive Director has just said. We met as a board sometimes 2 weeks back to look at all the requests submitted by the importers. I think we realize the fact that we are coming from a very difficult time. We are going through a transition, and we need to manage this transition very well in order not to bring unnecessary stress on the supply system, knowing very well that these are commodities that are needed on a daily basis in our health facilities and at our drugstores. Also realizing the fact that the public service, the public system cannot supply all these important medications. We are seeing the importers are partners, very important partners in the pharma sector. Without them, the population will suffer. We put so many considerations in place. The foremost is the public health. That's the foremost we put. And there we have to balance the act. There are two extremes here. One, we want to say the safety of the patient. two, you want to ensure the availability of this product. How are we going to strike the balance, knowing the fact that there are certain mandatory requirements that the board, MCA in particular, need to perform? How will that infringe into the fact that availability is to be assured? So looking at all these things, it was a very difficult situation for us. But we said for now, we need to manage this transition. It was a very difficult decision for all of us. But we said to ourselves, let's waive the mandatory testing for now, and then do testing based on risk-based analysis, putting into the context the product formulation, where some products are very stable, the active ingredients and the excipients used in the manufacturing of the products may not be too toxic when injected. But looking at the other formulations where the active ingredients or the excipient used can be toxic to individuals. And again, the way these formulations are conducted, so we're now recommending the testing to be on that basis. Again, we want to look at areas where these drugs are coming from. We want to ensure that these are done based case by case, where the supplier, if it's supplier of reliable quality, is reliable and the quality is assured, and then suppliers who are not known to us, suppliers that are not regular suppliers to the country, we need to do all those background checks. So based on those facts, we'll do risk-based testing. On the issue of registration, as Mark rightly said, it's a regulatory requirement, and it will be difficult to waive it. Yes, we know we are going through a transition. We relax it at the moment, based on the fact that we don't want to interrupt supplies. But the importers need to know that this cannot be lifted. It's a mandatory requirement. Failure to do it, we might be fined one way or the other. But for now, it's been relaxed just to give them time to do all the necessary documentations. And where documentation is proven difficult, and we are sure of these products coming from a stringent regulatory authority, I mean, the amount of documentation required will also be looked into. And I think we can waive certain documentations just to facilitate the process to go ahead. These are all steps that we are doing as a board. We recommend this to the executive director and the team to implement them. I think that's the way forward. It will be important if we can engage the importers in a more constructive way. It's a win-win situation for all of us. Looking at the bigger picture, that the Gambian population need to be protected, the Gambian population need to be given quality health system services. It's all into that context, and we all have to see it in that way. I don't think it's good enough for them to threaten that they are going to shut down. I think the goodwill that the board and then the executive director team has shown to them, this will also reciprocate in a way that we can meet and have a win-win situation rather than sending those kind of signals. I think that's what is my vote to make. Thank you.
Okay, thank you very much. Do you have anybody on your side who wants to say anything before we have to go to members? You okay? Before I give the opportunity to the members, I would just want to highlight some of the things that you mentioned. That is the issue of the communication that is on the pipeline that has to do with the increment of the cost of listing. That is from $25 to $50. What really informed that decision? That we will want to know. And also the registration of all products according to the letter. We we also want to know who gave those directives so that we know what to do at the end of the day. So these are the two things that I just want to ask before I allow honorable members to come in.
Okay, I'll start with the second one. All products must be registered. That is something that has been in the act. It's just something that has not been implemented because of human resource and because also you cannot say that products need to be registered before they come into the market, because then no product will be in the market, because it takes time to submit, it takes time to evaluate, it takes time to approve. So all these processes, you know, you cannot just say, I started now, the act has started, and then we will implement it all fully. So this is why we have been implementing registration, and then we also put in another mechanism which we call, which is an international best practice, which we call listing, so that products that you cannot actually register because of capacity, because of also, you know, all the other challenges, you will list them to know that these are the products that are being imported by X, Y, and Z, and they, you know, you get the details in terms of the database, having the database of the product so that you can trace it and you know, if there are any problems, etc. So this is nothing new. It is only that when the ACI became an issue, we were having problems with, you know, started having problems with those quality of medicines. And then the investigations came and everyone is saying this is what the act says, this is what the, you know, then it became to say, okay, fine, if everybody is saying that we implement what the act says, this is what the act says. And then of course, it became a stalemate because then it wasn't also feasible, it wasn't happening. The president called to say, what are the issues? We explained and he said, okay, let's try and see, in the interest of the public health, in the interest of people getting their medicines, we will then, you know, continue what we were doing in terms of registering and also listing, trying to put quality measures in place until we, you know, find our footing. As Sabari just said, it was a transition because it was a challenging period. We're going through a transition and we're trying to put in modalities to manage the situation in the interest of public health. So this is it. So it is nothing new. And as I said, even from that meeting with the president, it was clear that waiving registration because it's coming from these other countries was not an option. We're going to try and see how best to manage it, or they're going to try and see how best to source their products, but it's not as if that these products are coming from those countries, so they will not be registered. So that was made clear at the level of that meeting. The issue of the listing, as I said, a listing, the gazetted fees of 2017 was gazetted to pay a listing fee of $25 every year. So, but for I think for the past, every year for each product that you are bringing in, the same product, if you're bringing it, you've not registered it, every year you're bringing it, you should list it. It's $25. Now, currently, as I said, we are not encouraging, from 2019 I think, because again, just as Sabri said, the MCA being a regulatory agency, together with the board, are always looking also at the best interest of the population. They wrote to say that, well, you know, it's becoming a problem, you know, every year, and some of the quantities are limited. So I think from 2019, new products, if you've listed it once, you do not pay annually. So they've sometimes have not been paying for quite a number of years. Now that we're saying registration is what is critical, and that's what we're insisting on. If you cannot register a product, you pay the requirement, fee requirement, you cannot submit the dossiers. You want to list it and we're giving you time, then you can pay this one-off $50, giving you a time to prepare yourself. Then by whatever, you have to then do the full requirements of paying the full dossier, full registration fees of $300, and then submitting whatever documentation requirements are needed. So I think that's what
It is actually what informed the decision
Yes.
to increase the price.
Yes, yes,
The cost rather to
yes,
$50.
yes.
Thank you very much. Any other honorable member?
I just have a quick one.
Yes, yes.
Good morning, everybody. Thank you very much for inviting us here. I have actually given the opportunity to some of the persons to deal with it. I must admit, since this AKI started, because the AKI started before I became chairman of the board. It was on when I became chairman of the board. And since it started, our board has been trying to look at measures to ensure that there's no repetition of such issues. It could be because of the AKI crisis that starting meetings were held. I think the board was never invited. I don't blame anybody for that. But I can assure you that the board also had discussions, and we tried to find ways to ameliorate the situation. The MCA was under a catch-22 situation. Either you implement what is in the act, or you try to find a balance on how to ensure that quality and safe drugs are available to the population in a timely manner. If they implement as per the act, the timely manner and the availability of the drugs will be affected. We want to make sure people get safe drugs. But if we act as per the act, there will be delays and the availability of these drugs will be affected. It could lead to increasing cost of drugs, scarcity of drugs, and so on. So, and we all know this country doesn't have the testing facilities. And if we keep on taking these drugs from here to be tested in foreign laboratories, one, it will be cumbersome, it will increase the price of drugs to our population, and our people are poor. So we actually had plans as to how best we could solve these ones. One of which was, as discussed, pre-shipment testing. We've discussed this, and we felt there would be a necessity for MCA, in collaboration with WHO and our foreign ministries and the embassies, to help us identify WHO certified or recognized laboratories in countries where these drugs are coming from. We cannot get it from all countries, but where most of our drugs are coming from are China and India. We can identify laboratories in these places and insist that whoever is importing drugs to our country, we must take those drugs to that laboratory, and the laboratory will test them and send us the test results directly. Those are plans that we have put in place. They just need to be implemented. I didn't even see your invitation, but I can assure you this is something that I personally discussed. And I have a copy of my own email which I sent to her. Was it the day before you said it also? Before I even knew that we were going to have this meeting on this subject. Other steps that we are also trying to do is to ensure that our drugstores are registered at the sources where they purchase these drugs, the wholesale places. So if a drug is brought in by a supplier, an importer into the country, into their warehouse, and pharmacy or clinic X comes to buy, say, 50 cartons of this drug, that pharmacist's name, contact number, quantity, date of purchase, expiry date of the drug must be registered with that wholesaler. So at any given time, we will know who purchased what, when, and how much. In case there are any crisis, we should go back to that place and just trace the drugs. It will make life easy for all of us. We also insisted on establishing an emergency call center for adverse drug reactions. Whoever has any reaction towards any particular drug can call and inform, and it will be recorded. That will be vigilance. It will help us to detect problems with any particular drug. We all know also that from drugs from established pharmacies, these well-known brand pharmacies, the quantity that our country is importing is so small, we cannot get this certificate of analysis from them. But these are recognized, well-established pharmacies, for example, Pfizer and so on, that the whole world knows they have very good quality control systems in place. But we also know that there are so many new pharmaceutical companies all over the world, particularly in Southeast Asia and in developing countries, that may not have those types of stringent quality control measures. And we must insist that drugs from those ones are tested. If we, while waiting for our own laboratory to be established, the testings have to be done from their source. That's the pre-shipment testing. But as far as we know, when it comes to the drugs, initially when AKI came, a lot of drugs were quarantined. But they were quarantined for a period, and MCA has released those drugs.
On 13th December, that was.
Yes. So the high-risk drug that we are talking about are mainly the syrups. Those are the ones that they are paying particular attention to. Thank you.
Yeah, thank you very much, Mr. Dr. Sanya. That's the board chair, Muslim Control Agency. And then by way of clarification during our inquiry on the AKI, it's by no way or means of excluding the board in whatever that we are doing. Whatever that we do here is guided by the Constitution of the Republic of the Gambia and our standing orders and our own terms of reference that we are given to us by the plenary. So we did our inquiry based on that, and the board was never oversighted because we know directly the implementing agency, that is the executive director and team, are working for the board because the board is the governing authority of the agency. So, and actually what we are interested in is like activities and so on. So we thought it necessary, like let's involve those who are doing the practice actually necessarily, and then we can have the board at times and so on. And then there are new ways and means we do things here. We could have invited you to come and present your activity report, annual plans and so on, but that I've also taken another direction. Financial statement and here, those are taken by different committees now. So that's why we could have never invited the board, but on this matter we thought it's necessary to have you hear from you. And we never know, even probably you came in during Agri. I know you came at a very difficult time then, yes, honestly. Yeah, but anyway, all the same, we are all stakeholders in this, and then we will continue to work together. So thank you very much. Honorable members, Honorable Baji.
Yes.
Yes.
Thank you, Chair. Thank you, Director and Board Chair. Yes, I think, yes, we are trying to find solutions to this critical problem, and they have written a series of steps have been taken, series of consultations have been made, and then decisions have been taken, and then according to this letter they have written, those decisions have been rescinded. That's why I want us to interrogate this letter to ascertain, because they've also proffered solutions, what they think can make it work in this letter. So I want to interrogate this letter to mirror their expert view with regards to what they are claiming is possible without affecting the supply or service of drugs. You understand? Yes. So according to them, like it's difficult to register medicines because suppliers are interested in major markets like Nigeria, certain places, so Ghana and other places. So because they have a huge population market. Gambia, we have only 2.6 according to them, and this makes it difficult for them to register those products. Those suppliers or manufacturers would prefer dealing with countries with higher population. Is that so? Whether you will allow me to bring all these things that they have raised, or you will go one by one, you know. So is that the case? According to MCA or international practice, is that the right? Is that the challenge to them?
But that is not. I mean, that is a situation.
I think by way of procedure, and then just ask your question.
Yes.
In case they can know them, but if you want to have that, maybe.
No. I'm not. It's a question. I just want to substantiate what they are saying is possible or it's not possible. So I can bring all my things. You note them now.
No.
No,
Then,
I think.
then you're right, because we are at somewhere, so we cannot just say because this is what they wrote and he says it's not possible. We swallow it whole line and sinker. We have an authority that's dealing with those people, and we don't normally. We should not just assume that whatever they put in this letter is right. That's what I'm saying. So they said this cannot be possible because of these reasons, and we have an authority, an institution that's working on these things. So they have to know international best practices. That's why I'm bringing this thing out.
Yeah.
So this one thing. The other thing is he said you've agreed already with the Office of the President and the ministry so that they produce the certificate of conformity and certificate of origin, and then give certificate of analysis where necessary. And then, you know, if this is what is agreed, it seems this new step is contradicting what you have agreed. You know, that is what is there. So if you know that one. So the other issue is, let me quote it, they are appealing that you approve a waiver for certificate of analysis and registration for items imported from Senegal. Because for them, those people already have documents from manufacturers from France dealing with Senegalese authority, and they don't expect, if their customers are importing from Senegal, you should be doing those checks. Do you think this is feasible? And also the same thing for products sourced from UK, EU, and USA. They equally appeal your office to approve a waiver and for certificate of analysis and registration, same as above. They can provide alternative documents such as certificate of origin, certificate of conformity, and MHRA link, which is the equivalent of MCA here in the Gambia, you know, to provide sufficient evidence for the quality of product they supply in the UK, you know, in compliance with the UK regulation or similar regulatory agencies. So these are two things I want you to look at. Is it they want a waiver for products from UK, EU, USA, you know, because for them it's difficult to have certificate of analysis from the manufacturers. They are dealing with suppliers, you know, and then it's difficult to get what they can provide is certificate of origin, certificate of conformity, and then they can provide the MHRA link that you can access and find out if the products they are bringing are in quality, of quality, and so forth. So they have issued solutions. They think it can work. So what's your point on these things?
Thank you very much on that.
You want to answer? You can
can start.
Yeah, you start.
Thank you very much, Honorable. The issue about the population, the reason I was a bit reluctant to answer is because these are facts, of course. Gambia is small population and small market. That is very, very true. If I go just because what you explained previously, I think has been mentioned in these 2 points where they're saying they're appealing, as I've said before, that because you're a small market, getting products from Europe, you cannot register, is not the fact. Difficult because of where they're sourcing it from, but that it is not a possibility, that is not. Yes. There are products that are coming from Europe that are being registered. These are there. It's just that, as I said, some, you can say that there may be some products that are specialized, that only maybe one or few people are using it. It's just for a niche market. For that, you can understand. But if you're wanting to bring in products that the antibiotics that are commonly used, antihypertensive, these are commonly used. You can have products that are coming from you that can be registered. As I said, I do agree that it can be a difficult issue because of the quantities they're bringing, but that it is not possible, it is not true. Okay? So as I said, we accept that there are challenges, but that it is not, no. And that also, I want to make it clear, I have never said that these products coming from these places will be waived or can be waived from registration. Clear in the front of the president, when they tried to appeal, I said, Mr. President, that one is a no-go. Products need to, we can see how best to accept minimized documentation, for example, but that to give a carte blanche, that one also I was very, very clear on. The other issue about the certificate of analysis, certificate of conformity, having certificates from the MHRA. As I said, initially we used to accept it. When Aki came, with just the challenge with, then we clamped down because we said, everyone said use what the Act says, that's what we're implementing. But we have reverted back to accepting in the meantime whilst we are going through this transition to manage the issue, which is accepting this certificate. I mean, I think maybe some issues are that you'll bring one certificate of conformity, or sometimes you'll bring certificate, if you're bringing a certificate of conformity, maybe bring it along maybe with a certificate of origin. Or sometimes you bring in documentation because they are in French, maybe they're having some hitches, but the fact that we are accepting, MHRA, wholesale and distribution licenses, certificate of conformity and certificate of origin, we have reformed, to that, at least in the meantime, to manage the transition. So to me, again, I don't think that one is still an issue. The other bit, I think also I'd explain about the mandatory testing. That one, as I said, I think Board Chairman mentioned it. I think that was the issue, but that was lifted from the 9th, I think 9th or the 13th of December 2022. And to date, I think the only communication that went for mandatory testing are the products that are new in the market, that are not registered, and they have, they are high-risk products. So we communicated to everybody to say, if you're bringing these, then these ones need to be quarantined unless they are tested. So I think these are the 3 areas, Honorable, if I recall.
Honorable, are you okay?
Are you
Yes,
okay? And I think Oma want to say something
I'm
else.
okay. One more thing. Could you differentiate I want to know the difference between listed and registration. Is there any difference?
Of course.
Could you explain that? Because we've been there.
The requirement, the law says the product should be registered, which means that a product dossier, everything from what goes in the raw materials, how they are tested, how the process is being manufactured, the stability data to check that, okay, yes, they can expire within 2 months or 2 days. Everything that they claim on the product has to be in the dossier. It is submitted along with fees, it is evaluated, and then if everything goes well, then it is approved. Okay? Now, for the listing, because of course, what is also done, sometimes you can take samples and so on and test them, but you don't have a lab, so that area of the testing, I think we're all aware that that one is something that we do not actually perform. The issue is listing. Listing is an interim measure. By right now, if all was going well, we should have stopped listing. But because of the capacity, we cannot do it. But the listing, what the requirement is that you submit the information about the product, the manufacturer, the country it's coming, the batch number, the expiry date, so that you can have a database of the product that is coming into the country, should in case you need to track it or trace it. So it is actually more of a collating information and database. So at least as a regulator, you know that this country, this importer is bringing this product into the country. So the listing does not require any much, but just maybe preparation of database, etc. Do you understand? And the registration also, once it's approved, it's applicable for about 5 years, and then you need to renew it. So this is the registration requirement.
Earlier you've mentioned perhaps there might be need to consider the documents needed in registration. Did you say that?
Yeah.
Yes. So
yeah.
I was thinking.
What I was explaining was that the challenges that they face when it comes to producing full documentation, because those are one of the challenges that they face. If you want to register a product coming from Europe, it's because they're getting it not from the manufacturer but from the wholesalers. That is why they cannot get product dossiers. But we're saying that you can always get, it's difficult, but you can get European manufacturers that can provide it. But it is a challenge because, again, of the small market. So what we're saying is if you cannot get, if it's a product that's been in the market for a long time, sometimes it's difficult to get the full product dossier. But what we say is sometimes we can accept abridged documentation. We'll say, okay, this is key, like the GMP of the manufacturer is key, the certificate of analysis is key. We can highlight few abridged documentation rather than submitting a whole dossier, just to make it easier for them to register.
Honorable, are you okay?
Yeah.
Is any other honorable member?
Yes, I just want to ask one. Yes.
Yes, let us just be mindful that by 12:30 we should close the meeting.
Yeah.
Yes, because we are working on official time, and then we are working with staff of the club who have to join public transport and go home. Yes, thank you very much. Yes,
the question that I want to ask, I'm a little bit confused because if you listen to her assertions, the CEO, it seems during our engagements, all our engagements, for me, she's always in the middle. If I said she's always in the middle, I cannot understand, because if you listen to the importers, what they are saying and what MCA is saying is quite different. Now the question that I want to ask you, that is, do we still have some imported drugs that are on quarantine at the seaport? If yes, what are some of these drugs? Can you tell this committee what are some of these drugs?
I think the other one I can answer. According to the information I heard from them, there is no drug that is quarantined as a result. There are two issues here. Quarantine as a result of testing, and maybe quarantine as a result of they want it to be registered. And then I think when we went out on tour, all the drugs that we found in the store, they are quarantined as a result of testing. And I think that ban has been lifted as the communication we received from them. Now the issue is, the bone of contention now is registration. Registration and listing. That's where I want them to help us understand, and maybe you provide a solution, because these people are communicating, bringing some other facts to it.
Can I say something on that?
Are you okay?
No, I understand that, but the question that I'm asking her, do we have imported drugs at the seaports that are under quarantine as we speak, is what I'm asking.
No. Yes, you can answer, madam.
Okay, I think I want to answer because you said, you gave a very good distinction, and I just wanted to mention, I wanted to emphasize that and then answer that question, because as you said, there were two things. Because of mandatory testing and the other one. Initially, at the beginning of the year, we were saying that a lot of products were put on quarantine because they were not listed, they were not registered. But again, it was a stalemate, as I said, and we've been struggling within, discussions to see how best do we go forward. And that's why I said we have now come to a decision where we said, okay, we'll allow them to be bringing it. But for example, these will be the conditions. We'll give them a time period to submit. In the meantime, they have to register the ones that they need to register, etc. And as I said, the communication will be out in the pipeline. Chairman was just referring to an email because we've been constantly talking about it. So that is a distinction that I'm very happy with, that we all understand. Now, answering your question, as I said, I am not aware because normally import permit clearance comes into MCA. It goes through the process. The inspectors see it. It's only normally when it has an issue that it escalates to my office, on my desk. But otherwise, it doesn't. And as far as I know, I've been asking, I think the inspectors to see, do we have any issues apart from what we have been discussing? Products that are being quarantined because of, registration requirements. And I think they've all been addressed. But the issue of products at the seaport, unless the import permit clearance is not on our desk, because I've been asking and I'm not aware of it. And I just want to say,
Maybe I should have taken an oath so that...
No, but I just wanted to say, Honorable Cora is saying I'm always on the fence. I'm never on the fence. I'm always clear with my communication. No, you said I'm always on the fence.
No,
you never know.
No, I didn't say that. I didn't say that.
Okay, then you'll track.
What I said,
because
you are always in the middle.
Well, I'm always in the middle. I'm never in the middle. I always keep my communication very, very clear. Is this or is this? So I just wanted to...
Now, there's a difference between on the middle and in the fence.
So I'm not on the fence. I'm in the middle. That's what I want to say. I'm never in the middle.
Thank you very much. Yes, Honorable Barrow, you wanted to come in. Oh, sorry, before you, Honorable Dawo. Sorry. Yes, Honorable Dawo, carry on.
Yes, thank you very much, Honorable Chair, for giving me the opportunity. Yes, I just want to ask the Executive Director.
Sorry, yes, sir.
Where is the misunderstanding about this issue of registration and listing testing? Where is the misunderstanding? Is it there is a miscommunication between you and the pharmaceutical association or what? Where is the misunderstanding? Because for me, to me, it seems that this product are under quarantine. That's why these people are complaining. And I asked you to clarify, and you said no, there's no quarantine or on syrups. And you made it very clear to the committee that testing and registration is a mandatory requirement. Sorry, registration and listing, is a mandatory requirement, and you cannot do away with it. But like you said, also, there is a need to reduce the documentation for registration if possible, something like that. So where is the miscommunication? Where?
Misunderstanding.
Yes.
What are they still asking?
I think, as I said, maybe it is just the timeline. Some products, again, as I said, from the beginning of the year, we were struggling with having, concrete actions just to try and assess the transition period and to manage the challenges. And there was a period, as I said, I think recently we have released quite a few. Some products were on quarantine, again, as you said, because of this registration and listing, not mandatory testing, but the registration requirements and listing requirements. Yes, and that one we have sorted it out. This is the communication I said is in the pipeline and will be coming out to the importers. The issue of, I don't also know where maybe the miscommunication of registration and listing should come out from. To be honest, I think it was a convenient understanding to say that products that are difficult to register because they're coming from Europe. I don't know, I saw that in our communication. That's they saying that we agreed. That has never been the case. So I don't know also where that misunderstanding came from. I cannot say because I've never said it and nobody can quote me. But if they're quoting me in a letter, well, I don't know where that came from. So I don't know, I cannot clarify that.
That's not suffice, madam. Not suffice. His question was where is the misunderstanding? And you say you don't know. I think that suffices.
Yes,
honestly.
yes.
Yes, that suffices. And unless if you're not clear.
No, it's okay, go ahead.
Yes, Honorable Malo.
My boss wanted to say. Anyway, thank you very much.
Your boss here, who is your boss here? you have a boss different from all here.
Okay, thank you very much. Well, I think
the boss guys should be outside.
what we heard from them is a way forward. We are in the middle between two of them. The importers are telling us that these people are making life very difficult for them, but think that is not feasible. And one of those issues that they appeal is the issue of the European products having documents because of the small market. And the other issue is we all understand we are on a transition and it's very tough outside there. For the fact that we are on transition and it's very tough outside there, how do we compromise the balance? And they come up with solutions. They come up with plans. I think the most important thing is let us sit as a family. That is the MCA, the importers. Because what we are explaining today, I believe if these people are equally opportune to understand the way that we understand it today, it will not have come to this level still now. Because they also have a constant that there are things that MCA is asking for them. It's very hard, and MCA is telling us that's true. It's not possible. But when they come together, they can give them a way out to make it possible. I believe that we should talk. And then for us, we were also interested in one thing, the interference from the minister. We don't know, and we want MCA to ball on the board. This is an agency that is under the umbrella of the board. We hear directive. We want to know where are this directive coming apart from the board. Because it also registers to us that the minister is having a lot of interference, and we want to stop that. Because this was enacted in Parliament here, and it's clearly spelled out who should do who and what should be done. We want to hold the minister in our oversight function to ensure that what is supposed to be done is done. And we want them to bold enough to tell us whether that kind of interference is happening there. Because in the letter, you can see that they say, you can agree here today, discuss something. When you go, MCAs will write differently. And these are things that we feel, is it the board that is giving directive? Is it the MCA doing it on their own? Because at the time, we regretted, this committee regretted taking bold decision, like the way the president took to write a directive to the MCA to say, release those products and let us as a country take the risk. We start blaming ourselves why we did not take that. Because the minister was not ready to take the risk. MCA was not ready to take the risk. We were ready to take the risk, but why we did not take the risk at that time? And we don't want interference. We want it to smoothly run. Because these people, when they suffer, we were on our tour. We find out that a lady was going for Aldomen. Wherever he goes in the pharmacy, it's there, but they cannot sell it. And we all know what it means. And we were very worried. And when these people also threatened that they would go into shutdown, after being explained that they are key partners, so we feel this is of concern, But what we learned today, I think is very important that you bring all these teams together, we sit down, because I really understand where the problem, but they have a case to say it is very difficult for some of these issues that you are asking them to do. It's not possible to them. It's very hard. Show them the way. And on that note, mine was more of a comment. So
Thank you. Yeah,
thank you.
Thank you very much. And then you made a very good recommendation that we should invite them probably with the MCA, not with the board, but maybe the management, chief executive officer, we explain probably to them so they can understand as we understand. That is also good.
We can even do that at our level.
Yes,
Yes, we engage
yes,
them.
That is our recommendation. Yeah. You know, what is right, and what is wrong is wrong.
Yeah,
But
definitely.
lack of communication sometimes also is a problem. Yeah, so that's a very good recommendation. So on the other side, where you are talking about directing, and I think the executive director said anything that they are supposed to do, since we perform oversight over them, it has to be based on the MCA Act and also the regulations. And I think they are standing goal on that. I wouldn't, and I will never hold maybe brief for them, but having worked with them for this while, definitely I have that trust and confidence in them. That I have to say, and it has to be on record. And the committee also have the trust and confidence in them. And that I don't think anybody can micromanage entire board and entire agency and so on. That is your mandate, and that you owe to the government people. That you owe to the government people. So those are just comments. We don't even need to respond per se, but we all know what we need to do and what we need not to do at certain levels. We are all seasoned public servants. But I know the board chairman, if you are not retired, you are planning to retire very soon. Likewise others. So these are issues which you know, just like that issues. But we have to understand one thing. We are politicians. We are from different angles, from different directions. And these women, we don't dispute them, we don't believe in them, but in our discussion we have to bring them on board so that we settle the dust here and there. So thank you very much, and then I think on that note, we will just recommend, and then we just want you to engage this Importers Association, tell them the prevailing circumstances, the facts, and the actions that we want to take forward. And please, on behalf of the committee, I am appealing that please maintain some of the words of wisdom that you said here, that we understand we are in difficult circumstances, difficult situations, and our case is very unique. So we need to sometimes the measures that we need to put in place will be very, very considerate. If not, we will definitely affect the people. And then I think you will definitely do that. Whatever that you are doing, despite sometimes it have to be, if you follow the law, I want to implement the law fully, you respect people. And then these are laws that are made by us, and in that, if there is any issue or any problem that you have within the act or whatever, and you want to recommend for amendments, please, our doors are open. Come and tell us we want to amend and so on and so forth. Come. We can definitely do that, and we will support you 100%. Yeah, we will support you 100%. So on that note, we move to AOB, the issue of your budget. Just quickly, because the figures we move on. Because AOB, yes, the issue of the, first of all, the issue of their budget. Can you please hear from their director?
Yeah.
The issue of their budget. You were not here when I was with it.
I had you.
I'm here now.
What I'm saying is, I said, don't be specific. You say AOB, so just leave it at that.
Yes, but I want this thing to come first. Yes, you hear from your finance director, please. Very, very important, please.
Thank you, Chairman. I think it was around, November or so, we came here to do some deliberation on the budget together with Minister of Art. So what MCA budgeted for under PEs was, 22.9 million. But on the approved at that time, the estimated was, MCA was giving only 13 million as OC. But finance then said it was meant to be both OC and PE, while our budget is saying differently. So I think with that, we came to conclusion that MCA will be giving 13 million as PE for the current staffs. without hiring any new staff, and OC for 6 million. But when the approved budget came out, we noticed that PE for MCA was only 10 million, which cannot even cater for the current staff's entire yearly salaries. The OC was fine as agreed, 6 million. But the PE is an issue, 10 million. Yeah. So when we engage finance, what we were told was, this is what National Assembly gave them. So I don't know. So even with that 10 million, when the allocation came out for the first quarter, we only received for the OC. 6 million divided by 4 is 1.5. We only have that one, that allocation. Even as of now, that money is not yet in our account, but it's in the process.
How did you receive your January salary?
That's the issue.
We have to reject
We do our things, so we pay the salary. But we wrote to them, and they still didn't respond to us.
Okay, order please. So now, what we want to hear from you, not actually based on maybe forecasts or whatever, but the actuals. How much is your payroll?
Yes, the actual, because why we come to that 13 million, I don't know whether you forgot, but we base it on the current staff's actual. The staffs on the ground, the actual.
Okay.
That was the 13 million.
Plus the 30%.
Yes, with the 30%.
With the 30%?
Yes.
13 million?
Yes.
That's 13 million,
Is it
exactly.
13.5?
It was 12.9.
13. It was 12, so we rounded it.
So now actually, in essence, your PE should be 13 million
Yes.
instead of 10 million.
Yes. But we were told they don't touch what was approved in the National Assembly. That's why.
I remember you had them.
Very well.
No, let's go to the actual for the OC. That's okay.
No, it wasn't okay.
It
but we
wasn't
agreed
okay.
It wasn't okay,
It was
but like,
approved
that's what they are
here
giving.
that
It's
6
more
million.
It's not even a matter of you agree or you agree. That's what they were giving.
Yes.
that is it. You know, finance.
But like during the budget session, what we approved exactly? I think this 13 million was approved.
Yes.
Yes, it was decided here. It was
No,
approved.
it was approved. So why did they cut it?
Anyway, okay.
I think we have added something under their budget also for the savings.
Yes.
How much was that?
10 million.
10 million, huh? So meaning the OC is supposed to go to $16 million.
No.
Yes, they have said.
No, but
No,
13
that addition was for
the establishment of the
establishment of some basic equipment that they would need to as a startup for.
That's why it should be at the OC.
So was that
No.
under
Because it's
MCA?
a
No.
10 million.
This is very, it's a bit confusing, but I think I will have to engage the deputy clerk, legal and procedural matter, we see. Because I fully remember when we did the cutting, we were having 30 million. We said 10 million, purposely this to go to MCA. Plus what was already budgeted for them. So now where is that 10 million? And then why is the issue of this PE?
That's what I'm saying, because MCA, whenever they're having only two budget line. That's the PE and OC. So if you are giving them anything for any other activity, that has to go to OC.
Yes.
So the 10 million is supposed to be added to that 6 million, make it 16 million.
Aha.
Yes, true.
That's it.
That's true.
So and we have approved that 10 million is for them for their PE.
No, PE nobody have said
Yeah, that was not because I told the Minister of Finance. Right with Vice Minister, there have never been a budget line to address this lab issue. There was no. And then we are serious on what we mean.
Yeah, but you know,
He agreed. The Minister agreed.
Yeah, he agrees,
MCA
but
is a sovereign
it's not
institution.
done like that. It's about
It can be
it's a
done like
program. Can I help you please? Order please. It's a program-based budgeting. MCA is subvented, and they are subvented under two programs only, OC and PE. Anything you are adding to them, you either give them more money to employ more staff, that is PE, or you give them money to spend on whatever that they want that is justifiable. That is under OC. So that is the problem. I think we will check it out with finance. We have some serious issues, not with you only, but with others, and we will check it out. I think now we have riders well and now MCA.
No, but let them commit. Because if finance is saying it's the nationals, let them write to us.
In their budget. that I have with me, and we will make
Maybe-
copies available.
Maybe it was during the input.
Way forward.
Yes.
Way forward.
Way forward.
We have to call the Minister, Health, MCA, and Finance to tackle this issue. That's all.
Yeah.
Okay.
If you give me the opportunity,
I'm not permanent secretary minister.
We have to minister.
having gone through the little time I had with them, that I think this is not needed address. Drugs, when I said I mean medicines, entering the country from all sections, from Senegal, Guinea-Conakry, Guinea-Bissau, almost different border points, at the Lumos, etc., with hardly any control. This is because of the capacity gap, particularly in staffs.
No.
They really need to employ medicine control agency inspectors, regional ones, in all regions, as well as those that will be in the municipal area here. Coming to sell us even antibiotics and all sorts of drugs in the street. And people buy this and consume them.
Yeah.
What happens?
Yeah. Again.
Nobody will know who sold it to you, the manufacturer, etc. So we need to increase the capacity of MCA. I know there will be budgetary constraint on this, but there is a provision within the Act which states that what they can retain that and use it only with the approval of the relevant authorities. Numerous letters to the concerned authorities, and nothing is happening. MCA can retain, say, 80% or 90% of the internal or 100% of the internally generated revenue long way in supporting to expand the activities of the MCA. So I believe that portion of the Act should be reviewed and amended. But also, if you could use your own office also to convince the Ministry of Finance about the need to expand MCA as an agency for it to be able to fully perform their mandate. And by that, it will mean an annual increment in the budget allocated to MCA for them to be able to recruit adequate number of inspectors and provide them with the relevant tools, for example, motorcycles, to be able to move from. Thank you.
Thank you very much. Then I think these are just words of wisdom that we've been hearing. No, there are challenges, but we definitely have to see how best we help them. Because at the end of the day, if problems happen, there are certain people in the Gambia, even within the ministry, give you where it is needed. The challenges we also have within our ministry, we will support you. And on this matter, we will act on it on an emergency basis and make sure we involve necessary stakeholders. We see how best we can reach a solution. So, any other issue?
Yeah, I just want, with what the board chair said, they work with their legal team to look at the percentage of their internal revenue collection that they would need. And they work around the legal team to see which part are we going to add. And then they can furnish us better so that we can pick it from there.
I think for the NCA, I think we are coming with general review of the acts.
That's it.
Yeah,
I just wanted to say that the ministry is coming up with a general review of all the acts.
Because anything that have to deal with monies attributable to the consolidated revenue, it cannot come as a committee or private member bill, but it have to come as a government bill according to the constitution. So let them fast track the process, be on them, and we will also be on them. I don't know what is the stage of that. Yes.
Yeah, just in addition, since this issue of review is probably going to take time. And just as the chairman said, and I think I've also communicated, the issue of the retention of the IGR. The Act says that they should agree on a percentage. But what is best practice? And in view of now we are struggling with funds, the funds that the MCA is collecting, they should give, what we're requesting for is that they can give us approval for the retention of, let's say 100%, because what they're giving is not even enough. We accumulated over how many years this amount? You know, they should be able to say, yes, retain it for so long until maybe it can really stand on its own 2 feet. I mean, even with the retention of the funds, they will still need subvention. Yeah. So, but as I said, requests have gone, like, you know, but no action has been taken.
Is that not in the regulation?
Yeah, in the regulation it says it, but then still, unless we get communication from Ministry of Finance, but they're just keeping quiet. Whenever we write, they just keep quiet on it.
Okay.
And that legally.
Okay, we will explore. We will explore it and see
Yes.
since it is already there and the monies are there.
Yes.
Anyway, we will explore that option too and see. And if these are provisions in it. I understand if you tell finance money, right? Problem, you know.
Probably we are told that there are a lot of money for the Ministry of Health at the below the line account, which the Ministry of Finance took all from them. Probably it could be. Call them and engage.
No, we will engage them. We will after. Yeah. Okay. Yes. Anyway, thank you very much, honorable members. And then I think it is best we draw the curtain here until next week meet again. But